Hey, how have you been? This is Dr. Shaikh from The Dentalist. In the last video, we talked about the basics of metals and alloys. I hope you have watched that video and have already cleared out your concepts related to metals and alloys. Today, we'll talk about gold and alloys of noble metals. First of all, I want you to understand what cast metal is. Casting is basically a process in which a liquid metal is delivered into a mold that contains a negative impression of the intended shape. The metal is then poured into the mold through a hollow channel called a sprue. The metal and mold are then cooled and the metal part, which is also called the casting metal, is extracted. I have made a separate video on that. I'll leave a link somewhere on the screen, and the process is basically called the lost wax technique. So whenever you hear the word cast metal, this whole process should run through your mind, giving you an understanding about the process of formation of these cast metal restorations. Now let's get back to our topic, which is gold and alloys of noble metals. In the cast condition, pure gold is too soft to maintain its shape under the forces of mastication. Its strength and hardness can be greatly improved by either cold working or alloying. Gold is very malleable and ductile and can be readily cold worked. This characteristic is utilized in the restoration of teeth using pure gold fillings. Alloys of gold are commonly used for cast restorations. Now, let's talk about pure gold fillings or cohesive gold first. When two pieces of pure gold are pressed together, metallic bonds are formed at their point of contact and the gold is welded together without the application of heat. This property of cold welding is utilized when building up a pure gold filling. However, the clinician needs to make sure that the surfaces of the two pieces of gold must be perfectly clean to allow intimate contact, and the applied force must be great enough to encourage the formation of bonds. Cohesive gold is normally used in the form of a very thin gold sheet or foil, approximately 0.001 millimeter thick. It's called cohesive gold because when the gold layers are laid together and brought into actual contact by pressure, they become permanently united. So on condensation into the prepared cavity, each layer of foil becomes welded to the material already condensed. It is a normal practice to heat the gold foil to about 250 degrees in an electric furnace or a gas flame before use to remove any adsorbed grease or gases that would prevent the efficient welding. The tooth to be filled must be isolated from the saliva using a rubber dam and thoroughly dried to avoid contamination during condensation. Condensation or plugging of the gold may be carried out by hand with an automatic mallet or by the application of a mechanical vibrator. The use of an automatic mallet involves the application of a relatively large force at infrequent intervals, whereas a pneumatic or electrically driven condenser delivers much lighter but more frequent blows. Care must be taken not to overheat the filling during the finishing procedures where the occlusal contour of the tooth is carved using rotary finishing instruments and then it's polished. Always remember that increased heating can cause damage to the pulp. The tooth and its supporting structures must withstand the fairly harsh treatment they receive during condensation without becoming damaged. Fortunately, both the dentin and periodontal membrane are fairly resilient. The mechanical properties of the pure gold filling depend on the amount of cold working carried out on the material. The degree of work hardening depends on the pressure applied during condensation and the length of time for which the material is condensed. Practical limitations of time and the pressure which can be tolerated by the patient restrict the hardness of the pure gold filling to values similar to those for the softer type 1 casting gold alloys. Sandwich foils of gold and platinum are also available, which produce a condensed restoration with better physical characteristics. These can be used to produce small Class II restorations using a similar approach. The advantages of the gold foil filling are that it is perfectly corrosion resistant and does not rely on a relatively soluble luting cement for retention. In cavities where the filling is surrounded by tooth substance or where there's little or no opposing force, the mechanical properties are adequate and the pure gold filling offers a very durable restoration. In high load bearing areas, certain properties of pure gold such as rigidity and elastic limit are insufficient to resist distortion. Apart from this, the high cost of these restorations in terms of material used and the time taken to produce the restoration precludes their use in all but a minimal number of cases. Now, let's talk about the 4 types of dental casting gold alloy. Type 1, which is low strength, for castings subject to very slight stress, example, inlays. Type 2, medium strength, for casting subject to moderate stress, example, inlays and onlays. Type 3, which is high strength, and it's for casting subject to high stress, for example, onlays, tin cast backings, pontics, full crowns, and saddles. Type 4, which is extra high strength, for casting subject to very high stress and thin in cross section, example, saddles, bars, clasps, crowns, bridges, and partial denture frameworks. Standards for dental gold casting alloys require a noble metal content of at least 75%. It can be seen that the gold content or nobility decreases on going from the type 1 soft alloy to the type 4 extra hard alloy. Nobility of gold alloy is often indicated by either a carat value or a fineness value. The carat value indicates the number of parts by weight of gold in 24 parts of alloy. Thus, a type 2 alloy containing 75% gold has a carat value of 18. The fineness value indicates the number of parts by weight of gold in 1000 parts of alloy. The type 2 alloy would have a fineness value of 750. ISO for dental casting gold alloys requires that of the minimum noble metal content of 75%, at least 65% shall be gold, while the remaining noble metal components shall be platinum group metals such as platinum, palladium, iridium, ruthenium, or rhodium. The most commonly used is palladium. The use of potentially hazardous constituents is discouraged as the manufacturer is required to list all the components along with the percentage of each. The increase in hardness observed when nobility decreases is primarily due to the solution hardening effect of the alloying metals, which all form solid solutions with gold. The types 3 and 4 alloys can be further hardened by heat treatments. The presence of significant quantities of platinum and palladium, as in the type 4 alloys, not only causes considerable solution hardening, but also leads to a widening of the separation between the solidus and liquidus lines of the solid solution phase diagram. The results of this is an increase in coring, as explained before in previous videos and this one too. So if you don't know what solidus and liquidus lines are and what phase diagram or coring is, you need to watch the last video for sure to clear out some basic concepts before proceeding further. The cord structure can be removed by carrying out a homogenization heat treatment. Platinum and palladium also significantly increase the melting point and recrystallization temperature of gold alloys, a fact which can be used to advantage when selecting alloys for components which may require soldering. Zinc, which is present to a concentration of about 1% in most alloys, acts as a scavenger during casting. It is the most chemically reactive of all the metals used and becomes preferentially oxidized at the high temperatures of casting. The resulting zinc oxide slag can be removed from the molten alloy. It is normal to reuse any excess alloy which is left after a casting has been produced, for example the alloy from sprue. Care should be taken when doing this to ensure that sufficient zinc remains to have an effective scavenging action. When all the zinc has been oxidized, the other metals of the alloy, particularly copper, become prone to attack. In order to minimize the chances of this occurring, it is good to practice to always include some fresh alloy in each alloy melt prepared for casting. Now, look at this table, as it gives an indication of the comparative properties of the 4 types of casting gold alloys. Moving through the series from type 1 to type 4, there is an increase in hardness, strength, and proportional limit. The corrosion resistance decreases as the gold content is reduced, although for practical purposes, all of the alloys may be considered adequate from this point of view. Ductility and malleability also decrease when the gold content is reduced. Now, here's another table that gives more detailed information regarding the properties of the alloys. It is interesting to note that the ability to withstand stress within the elastic range is given by the 0.2% proof stress as opposed to the proportional limit. The proof stress, as we talked in the last video, is more readily determined and arguably more meaningful than the proportional limit. It represents the stress required to cause a permanent deformation of a particular value, which is 0.2% in this case. The variation in alloy properties with composition is reflected in the applications for which the materials are chosen. The relatively soft type 1 alloys are used for inlays, as we talked before in the video, which are well supported by tooth substance and which do not have to resist large masticatory forces. The high values of ductility of these alloys enables them to be burnished. Burnishing is a process which improves the marginal fit of the inlay and increases the surface hardness. The need to improve the fit of inlays by burnishing has decreased with improvements in casting accuracy. The type 2 alloys are the most widely used alloys for inlays. They have superior mechanical properties when compared with the type 1 materials, though at the expense of a slight decrease in ductility. The type 3 hard alloys are used where there is less support from tooth substance and when opposing stresses are likely to be relatively high. Examples of the use of these materials include the production of crowns and inlays for high stress areas such as class 2 cavities and molars. The type 3 alloys with a high copper content, more than 8%, can be heat treated in air at 400 degrees for 10 minutes to produce a stable copper oxide layer on their surface. Chemically active adhesive luting resins can then be used to bond such structures to tooth tissue rather than relying upon mechanical retention form and a conventional luting cement for retention. The high platinum and palladium content of the type 3 alloys, leading to a higher melting point, is beneficial when constructing components for bridges which are joined by soldering. Type 4 alloys are used in high stress areas and for constructing components of partial dentures, and for this reason are normally referred to as partial denture casting alloys. Partial dentures normally have clasps or other devices for retaining the denture. These must be flexible enough to engage undercuts in standing teeth, but have sufficiently high values of proportional limits such that they do not become distorted. The type 4 gold alloys possess this useful combination of properties. In addition, the alloys have sufficient ductility in the softened state to allow slight adjustments to be made. Attempts to carry out adjustments on a heat-hardened alloy may lead to fracture due to the decrease in ductility which accompanies hardening. The connectors of partial dentures, be they bars or plates, should be rigid and resist distortion. whereas the proportional limit of type 4 gold alloys is sufficiently high to resist distortion. The connectors must be constructed in fairly thick section in order to produce sufficient rigidity due to the relatively low value of modulus of elasticity of these alloys. Some base metal denture casting alloys have higher values of modulus and from this point of view are more satisfactory for producing connectors. It is often claimed that gold, alloys of gold, and other precious metals can be considered well tolerated by soft tissues and by the body in general, so they are biocompatible. However, contact allergy to gold is not as rare as may be imagined and can be readily demonstrated using patch testing using gold salts. Blood levels of gold are correlated with amounts of dental gold and with the incidence of gold allergy, but little is known about the possible effects of gold circulating in the blood. The effect of exposure to palladium on human health has begun to receive some attention. The use of palladium in both dental and non-dental applications has more than doubled over recent years. A source of concern is the risk of sensitization to palladium, as very low doses are sufficient to cause allergic reactions in susceptible individuals. Dental technicians are thought to comprise a group which is known to be occupationally exposed to palladium and therefore are always at risk. Individuals with known nickel allergy are particularly thought to be at risk to palladium allergy as well. Protection from adverse reactions is best achieved through the use of alloys having good corrosion resistance, or in severe cases to the use of palladium-free alloys. Furthermore, it has been suggested that patients who have an allergy to nickel should be informed that exposure to palladium-containing alloys may result in palladium allergy. Although the risk is relatively low. Now, the type 3 and type 4 casting gold alloys can be further hardened by heat treatments. Hardening heat treatments are hardly ever performed for type 3 materials, but are occasionally used for type 4 materials, which are to be used in very high stress-bearing situations. The hardening process can be explained by consideration of the phase diagrams for the silver copper and gold copper systems. Hardening heat treatments are not beneficial for the types 1 and 2 alloys because they contain insufficient quantities of copper and silver. The silver copper system is a good example of an alloy in which the component metals are only partially soluble in the solid state. The solidified alloy consists of a mixture of two solid solutions, one in which small quantities of copper are dissolved in silver, called the alpha solution, and one in which small quantities of silver are dissolved in copper, the beta solid solution. The phase diagram for the silver copper system shown here resembles in some aspects to the eutectic phase diagram that we saw in the last video. The solidus is defined by the line ABECD, while the liquidus is given by AED. The compositional limits of the alpha and beta solid solutions are denoted by the areas marked by alpha and beta on the phase diagram. The lines B, F, and CG are termed as solvus lines and indicate the decreasing solubility of copper and silver and copper as the temperature decreases. Thus, the solubility of copper and silver is around 9% at 780 degrees, which is the eutectic temperature, but only around 2% at 400 degrees. This relationship between solubility and temperature is normal for any system of limited solubility. When an alloy of the eutectic composition, 72% silver, 28% copper, is cooled from the molten state, it undergoes solidification at a constant temperature, equivalent to the point E on the phase diagram. The solid formed is a mixture of alpha and beta solid solutions in which the alpha has composition equivalent to point B, approximately 9% copper, 91% silver, and the beta has a composition equivalent to point C, approximately 8% silver and 92% copper. An alloy with slightly more copper than the eutectic composition, a hyper-eutectic alloy, solidifies to give the eutectic mixture plus additional beta solid solution. An alloy with slightly more silver, a hypoeutectic alloy, than the eutectic composition, solidifies to give the eutectic mixture and additional alpha solid solution. Using tie lines, it can be shown that during crystallization, the excess solid solution crystallizes first and that the eutectic mixture is always the last to crystallize. If the alloy has either less than 9% or greater than 92% copper, then the solid formed is either alpha or beta solid solution. No eutectic mixture is formed. When casting, generally alloys are cooled rapidly to encourage the formation of a fine-grained structure. At low temperatures, the alloys become rigid and atomic diffusions become difficult, if not impossible. The structure of the alloy, which was formed during crystallization, becomes frozen into the alloy at room temperature. Despite the fact that the solubilities of silver and copper and silver are negligible at room temperature, they exist within the eutectic mixture, alpha and beta solid solutions, in which 9% copper remains dissolved in silver and 8% silver remains dissolved in copper. If diffusion was possible, there would be a tendency for copper to precipitate from the alpha solid solution and silver to precipitate from the beta solid solution. It is possible to heat the alloy to a temperature at which the solubility is exceeded, but at which atomic diffusions are possible. In the temperature range 300 to 600 degrees, slow diffusion of copper atoms can occur. Given sufficient time in this temperature range, copper would begin to precipitate from the alpha solid solution. However, a significant hardening of the alloy takes place, presumably because the diffusing atoms have effectively prevented movement of the slip planes. This forms the basis of the precipitation hardening procedure used for type 3 and type 4 casting gold alloys. The same process may occur to a lesser extent and at a much slower rate at room temperature. Hardening which occurs in this way is referred to as age hardening. Now, gold and copper form a continuous series of solid solutions over the whole range of compositions. The solid solutions are random, substitutional solid solutions with face-centered cubic lattices. Now, look at the phase diagram for the gold-copper system. It can be seen that the solidus and liquidus are close together and almost coincide at point M. Two other areas on the phase diagram at compositions between 40% gold and 90% gold indicate regions in which the alloys are capable of undergoing a solid to solid transition to form an ordered rather than disordered lattice. The ordered lattice, in which gold and copper take up specific lattice sites, is often referred to as a superlattice. Formation of the superlattice requires that an atomic rearrangement must take place by diffusion of atoms. This cannot occur at normal temperatures since there is insufficient energy in the system to allow diffusion to occur. Consider, for example, an alloy containing 75% gold which lies within one of the areas of interest. If this alloy is heated to a temperature in the region 200 to 400 degrees, sufficient energy is imparted to the system to allow atomic diffusions to occur. Atoms take up their preferred sites and the superlattice is formed. In this case, the superlattice has an ordered tetragonal structure as shown here. In alloys containing 40 to 60% gold, an ordered superlattice is formed. The change in size and shape of the gold to copper lattice sets up a resistance to the movement of slip planes within the multi-component casting gold alloy, which results in a significant increase in hardness and strain and a reduction in ductility. Heat treatments which are used to carry out this hardening procedure are termed as order hardening heat treatments. On melting the alloy prior to casting, any metallographic structure which is possessed as an ingot is lost and a new crystal structure is created as the metal freezes inside the mold. It is important to quench the gold alloy castings before they cool to the range of temperatures within which heat hardening takes place. An alloy which is allowed to cool slowly to room temperature will undergo both precipitation and order hardening prematurely. Before any alteration in shape of such a casting is attempted, it must be softened by cooling rapidly from above 600 degrees. Normal casting procedure is to leave the mold until the gold visible in the sprues of the casting is no longer at red heat. This indicates that the internal metal temperature is about 600 degrees. The mold is then plunged into cold water in order to chill the metal quickly and cause disintegration of the mold. Rapid cooling also helps to ensure a fine-grained structure. The casting is then cleaned, and when platinum or palladium are present, and homogenization heat treatment may be carried out to remove coring. This involves heating to 700 degrees for 10 minutes and then quenching. The casting is then polished and its fit in the mouth is checked. Any minor adjustments such as bending of clasps, etc. are made at this stage while the alloy is still in the softened state. If adjustments are made, a low temperature stress relief anneal should be carried out. The hardening heat treatment may then be carried out with type 3 and type 4 alloys by heating the casting to above 450 degrees and allowing it to cool slowly until its temperature has dropped to about 200 degrees and then quenching. This takes about 20 minutes for an average sized casting. The precise details of the heat treatment vary from one alloy to another, and the manufacturer's instructions should be followed. The procedures are designed such that hardening by both precipitation and ordering can occur. In practice, hardening heat treatments are hardly ever performed on type 3 alloys and only infrequently for type 4 materials, indicating that the properties of the cast material are adequate for most purposes. Following hardening, the casting is repolished, and in the case of denture, the teeth are added in order to complete the job. Ideally, all hardening and softening heat treatments should be carried out in a pyrometrically controlled furnace. The castings should be supported by sand or another refractory material in order to prevent sag at elevated temperatures. The two major groups of alloys covered by this composition range are the low gold content alloys and the silver-palladium alloys. The standard recognizes the need to specify maximum allowed concentrations of toxic metals such as cadmium 0.02% max, and beryllium, which is also 0.02% maximum, and nickel 0.1% maximum. There is no beneficial effect of having these metals present, and the limits are designed only to ensure that proper checks on impurities are performed. Large increases in the price of gold have led to the development and increased use of alloys with lower gold content than those described previously. Some alloys contain as little as 10% gold, but more normally a gold content of around 40 to 50% is used. They have a high palladium content, which imparts a characteristic whitish color to the alloys. The increased popularity and use of these low gold alloys has led to the development of an ISO standard for dental casting alloys with a noble metal content of 25% up to but not including 75%. There are 4 types of alloy equivalent to those previously described for the high gold materials. The mechanical properties for both high gold and low gold alloys are characterized in the standards using measurements of proof stress and elongation at break, a measure of ductility. The casting techniques and equipment used for low gold alloys are similar to those used for conventional gold alloys. This, coupled with their acceptable properties, good clinical performance, and lower cost compared to the conventional gold alloys, has led to their widespread use. The silver-palladium alloys contain little or no gold, and as their name suggests, they primarily contain silver and palladium. There is generally a minimum of 25% palladium, along with small quantities of copper, zinc, and indium, in addition to gold, which is sometimes present in small quantities. The silver-palladium alloys have significantly lower density than gold alloys, a factor which may affect castability. For a given volume of casting, there is a lower force generated by the molten alloy during casting.
In this regard, there appears to be a significant variation amongst the brands, indicating that small variations in composition can affect castability. Some silver-palladium alloys have castability characteristics which compare favorably with the gold alloys. Attention must be paid to details such as casting temperature and mold temperature if the mold is to be adequately filled by the alloy. Alloys containing large quantities of palladium have a propensity for dissolving oxygen in the molten state, which may lead to a porous casting. Measures must be taken to avoid overheating or oxidation of the melt during casting. The properties of silver-palladium alloys are similar to those of type 3 gold. Materials claiming compliance with the ISO standard for casting alloys having a noble metal content of greater than 25% must meet the specification limits set out. There are significant variations in properties between the individual brands within each of the two groups. Whereas most gold alloys have high ductility as demonstrated by an elongation value above 15%, some silver-palladium alloys have much lower ductility. The corrosion resistance is not as good as for gold alloys, but provided the palladium content is above 25%, the amount of corrosion expected during service is negligible. These alloys offer a suitable alternative to gold alloys provided that care is taken during casting. They offer a considerable saving in cost when compared with the gold alloys. Some larger restorations appliances produced from cast alloys are produced in 2 or more parts, which are then joined together by soldering or brazing. This approach is used to overcome distortions that may occur during cooling for metal frameworks for long span bridge works, and also when joining metal components formed from different alloys. For example, a type 4 gold veneer crown may be joined to a precious metal porcelain bonding alloy structure for bridge work. In dentistry, the terms soldering and brazing are used interchangeably. However, in normal metallurgical terms, the two processes, although trying to achieve the same goal, are carried out at different temperatures, brazing being a process carried out at higher temperatures. The definition of a dental brazing material given in ISO standards is an alloy suitable for use as a filler material in operations in which dental alloy parts are joined to form a dental restoration. The requirement of a brazing material for noble alloys is that it be capable of forming a strong corrosion-resistant joint between the two components being joined without changing their structure or properties. Hence, the tensile strength of the brazed joint is required to exceed the 0.2% proof stress for the weakest of the two components. There should be no visible signs of corrosion when a brazed joint is soaked in a solution of lactic acid and sodium chloride for 7 days. In order that the components being joined do not suffer from recrystallization, grain growth, or distortion during the brazing procedure, it is important that the brazing material has a flow temperature, which is well below the melting point of the alloys being joined. The flow temperature is defined as the lowest temperature at which the filler material is fluid enough to flow into the gap and to wet the surface of the metallic parts. Solders for joining noble metal components are formulated from mixtures of gold, silver, and copper designed to have low fusion temperatures. This is achieved through the eutectic nature of certain silver-copper alloys and through the addition of tin and zinc such that the fusion temperature of the solder is generally 50 to 100 degrees below that of the casting gold alloys. Solders are susceptible to oxidation during the melting or softening procedure, and the resulting oxides can weaken the solder joint. Furthermore, the metal components being joined are often coated with a thin oxide film, which can limit the ability to achieve the proper jointing. Fluxes are employed to break down the surface oxide layers on metals and to prevent oxidation of the solder. Fluxes commonly used are fluoride salts and borax. Fluoride salts are particularly useful in breaking down the tenacious oxide film which forms on the surface of chromium-containing alloys. Alloys of precious metals are commonly used for the fabrication of metal-bonded ceramic restorations. Their requirements are thermal stability during firing of the ceramic, bonding to the ceramic, compatibility with the ceramic, and support for the ceramic. Biocompatibility of the gold and other precious and semi-precious alloys are generally regarded as having good biocompatibility. However, the literature contains some disturbing reports of severe cases of allergy to gold alloys and high palladium content alloys. Though rare, these events serve to remind us of the need to assess and monitor all materials in the clinical situation on a case-by-case basis. That is all for today, my friends. I hope you have understood the significance and use of gold and alloys of noble metals effectively. I have also prepared a quiz for you. Make sure you check your retention and understanding of this topic by solving the quiz. Find the link in the description. If you have any questions, please feel free to write them in the comments. Also, please like and share the video if you still haven't, and I'll see you in the next one. Take care till we meet again.